Hey everybody, welcome to episode 58 of Pealed Back's LiveCast Conversations With. As always, I'm your host, Gene Bernier, the enjoyment coach, and my good friend, Dr. Jeff Moody's on the show today. Jeff is a board-certified UCLA-trained practicing urologist and author of The Doctor's Burnout, A Physician's Guide to Recovery. With over 20 years of experience during that time, he survived at least 6 electronic medical record transitions, the Affordable Care Act, and a practice consolidation. He's also served on numerous local state and national healthcare organizations. Dr. Moody knows the warning signs and the challenges of burnout personally, having lived through the diagnosis, treatment, and recovery. And if you're interested, he has a free webinar around the 5 steps doctors use to finally break free from the burnout, sleep like a baby, and reclaim their energy without sacrificing their time. Jeff, all those words cannot do you justice, my friend.
Well, I think it's more than enough, Gene. That's all I can say. Yeah, sometimes you're like, I don't know if I can live up to my own, press. It's, but I do. I want to go back to the intro. I think we should go back to the music again. That was awesome. Like I think I might get more benefit out of listening to that for 30 minutes than listening to me. So,
we're just going to make this an exercise show going forward. Everyone, all the guests have to dance all the way through.
If you know, do you know Darius Mershazadeh?
I do not know.
Oh, he starts every show. Same thing with music, and so everyone's always dancing at the beginning of the show. So very exciting. But that's not why people are here, Gene. People are here because they're burned out.
That's exactly right. Get here. Let's learn about burnout. Let's learn about how it shows up, and more importantly, how to treat. I had your book. Where I put it away. That was a horrible guest move of me. Everybody, make sure you go get your copy of The Doctor's Burned Out.
And I tell you, it's pretty interesting. I'm a physician. I've been a physician for 30 years, and I have had realtors, lawyers, accountants, mortgage brokers, and look at the book and read the book, and they're like, the burnout is the same. It's unfortunately uncannily universal. At this point, and it's not that they're like, the examples are different. You have medical examples in my book, but they're like this. The burnout occurs anywhere, and I think that's the kind of the biggest message that I want people to kind of, if they take away nothing else from us chatting today, is that it occurs, and just like you thinking you're having a bad day, the same bad day every day for like a year, that's not just a bad day. I mean, that is most likely burnout. And so, the first step in the 12-step program is realizing you have a problem. And that is that's what I try to get people to do. Just you know what? A, it's okay to have burnout. B, it's okay to raise your hand and look for help and ask for help, because, one of the issues in medicine, and I think I'm sure this is true in other professions, is that you are used to being looked at as the expert, and then you should know all the answers. Like, well, you should know all the answers about medicine since you're a doctor, but then why don't you know all the answers about burnout? Why can't you help yourself with your own burnout? Because I feel like we're really good at taking sets of information and processing them and helping someone else. I think we're horrible. We're never taught how to do that for ourselves. And so I think that's one of the huge things that I like to impress upon people, is like, let's get it out of your head and get it out into the open where somebody else can help you.
Well, I think that's like, as you're talking about that, it reminds me of that old story about like the shoemaker and his kids having the worst shoes around. Is like, so often it's so hard to take our own medicine. It's just like to have that reflection in the mirror. Like you say, can you have a string of bad days? Yes. If you have a string of like a year of bad days, be like, you need a solid like reflection, like something is not right, because life is truly meant to be enjoyed.
Yeah, well, as the enjoyment coach, you so eloquently state that all the time. But it is one of those things. It's like you, and the other thing about burnout is like I think it's, if there are 1 million doctors in the United States, and the studies show anywhere from now. Back in the good old days, 2017, it was about 45% burnout. Now it's somewhere to 70 to 80% because of the pandemic.
I could only imagine what it's like in your profession right now. Like,
so if there are 800,000 doctors in the U.S. burned out, then there's probably 800,000 different ways that manifests. I mean, some people like me are kind of hot reactors, are angry. Some people get quiet. Some people have substance abuse issues around it because they're kind of trying to medicate themselves. And some people commit suicide. About one physician per day in the U.S. commits suicide.
That's a huge stat. Like,
yes.
and that speaks to like the underlying, like, why is that happening? Because people are exhausted.
Well, I think there's 3 clinical hallmarks. A person named Christina Maslach kind of defined burnout as depersonalization, lack of personal accomplishment or cynicism, and emotional exhaustion. Those are kind of the 3 clinical hallmarks of burnout. But I kind of like to add 2 more: hopelessness and helplessness. People feel like there's nothing they can do to get better, and that they're like powerless, or they're helpless to actually make any sort of changes themselves, that are, they've gotten so used to it. So you're kind of, one of the issues, the medical training just kind of like beats you down, like to the point where you have to do whatever they say you have to do. And I think at some point you just have to say, no, that's not actually true. You have to stand up for yourself, and you have to kind of like fight back, so to speak. You have to take control or have some agency over those parts of your life that really affect you, and where you spend, 10, 20, 30 hours in a row or something, or more doing those things.
Well, and I think, like, as you said at the start of this, is like, this doesn't just apply just to doctors, like that helplessness and that hopelessness, that you fill in the blank, that's a person problem, right? It doesn't matter the exterior job career hat that you put on. Is like, are you somebody that's going to get unfortunately stuck in a position where you think that you don't have a say in what you do?
Or a choice, and no power, and no agency. And to circle back to suicide, I think people get to the point where they feel like that's their only solution. They have no way out other than of their pain and ending their own pain. And that is the real tragedy. I mean, like, I feel like if I can help prevent one physician from committing suicide, then all of this is worthwhile. Yeah.
Well, let's talk about like what it's, maybe let's talk about some of like the early signs that you see, and then we'll talk about what it's like to actually pull out of it when you like somebody grabs you by the shoulders and go, Jeff, you're burnt out. Then what? So let's start with like our mild case, and then we'll talk about the deep case.
Yeah. Well, so I think most people, the symptoms are they're frustrated. There's, I think the way I think of this sometimes, it's like an expectation mismatch. Like, you think you're going to get out of medical school or residency or training program, and you think you're going to just go see patients and help people all day. And then somebody, like with a pencil, and they're going to push it in front of you, or a computer keyboard. They say, well, yeah, you can see the patients, but you got to do all these other little tasks that take only like 5 or 10 minutes per patient for your entire career to do all these tasks. And so all of a sudden, the next thing you know, like the time you actually get to help spending, with patients and helping patients gets smaller and smaller, all the other tasks. Then, excuse me, the next thing you know, you're spending 3 minutes with a patient and 20 minutes, finishing the electronic medical record tasks. And all of a sudden you're like, why did I go into medicine? I did it because I like people, and I want to help people, and I want to interact with them and figure out what's going on, and help them with their problems. And it's almost kind of like all these other tasks have overtaken what they do. So I think people get frustrated. I think they start to do work at home at night. It's called pajama time, where like you're finishing up your work from the day, because you can't actually do the work during the day. You have to see the patients during the day. People are spending like 1 to 2 hours per week outside of the office doing these tasks. So you're frustrated with that. You're maybe late getting home. You're missing time with your family. You're missing time to exercise, care for yourself, sleep well, eat well. I mean, all of these things are very additive, to the point where then you're just like fed up, and you're just like phooey. One of my buddies here in Colorado Springs, he's like, they're like hanging on for one more year until their retirement plan kicks in, and then they're done. And he and I talk about this a lot. He's read my book. He's actually getting an advanced degree in healthcare policy, and it's just even as much as we talk about it, sometimes it feels like it's almost inexorable. It's very difficult to get past it. Again, the different manifestations. Again, some people get sad. Some people get very quiet. I've had clients where they can't even really talk about it. They're so they're so kind of what I would say closeted, or they're so closed off to how they really feel, and they feel like there's nothing they can do to get to make things better. And then as things progress, usually there's what we call the sentinel event. Usually that's some sort of a behavior outburst, some sort of an incident that occurs in the hospital or the operating room or the office. That's kind of how I chose to start my book, is that there was a little sentinel event in my office, and we call it, sorry. I should have the book turned down the page here, but I don't know if you can see this or not, but that we call that in my office the keyboard moment, where I snap my keyboard in half after basically an entire day of my electronic medical record stuff got wiped out. So like 2 or 3 hours of work. So then I had to repeat all of it, and I was so frustrated.
Over the knee?
Yeah, well, actually over the side of my desk. So yeah. So that was frustrating for me.
I think that's that's probably putting it lightly. Is like saying by that point you were probably beyond frustration.
Well, and that was like the 439th thing like that. That was the worst one. That was the one that cost the most time and frustration. But it's like Nick, just like picking at you every day. And I'm sure people, whatever your profession may be, I think people can identify. There are just certain things that every day they have to put up with. And I think one of the things that we always try to talk about with our clients is that let's talk about like taking, we call those the blood boiling events, or the hair pulling events, and like, what's one thing you can do to change that around, and let's take that action today, tomorrow. If it's an issue with the EMR, let's go find the EMR guru and learn everything you can so you can be more efficient with it. Hire a scribe. Like in medicine, there are the people where you can just have someone be your personal transcriber. And typical cost for that is seeing about one extra patient a day. And we have kind of a modified scribe program that we use in my office. But yeah, I mean, it's so worth it. Like there was one little tweak I used with my medical assistant where I taught her how to do something that saves me about 15 or 20 minutes a day for the rest of my life. Yeah. So it's just it's kind of one of those things. I feel like burnout doesn't happen overnight. It doesn't get better overnight. So that's why one of the concepts in my book is I talk about this thing called the burnout box, which is kind of, I feel like your life essentially is kind of a structure that you have either built around you or has been built around you by either your own decisions or lack of decisions, kind of tacit approval. And there are different surfaces. The floor is your past experiences. The walls are your, mental, physical, spiritual, social, work environment, financial. And then the ceiling is all of the, kind of like either limiting beliefs or goals that you may have. And unless you actively construct those with intention, going forward, then next thing you know, it can be a very constricting box. And the first time I described this kind of concept to people, and they're like, "Do you realize that's the shape of a casket?" I was like, oh, that was not my intention in any way, shape, or form. But yeah, it's a 8-sided box, and it could be construed to be in the shape of a casket. And I do think if you allow your box to be constructed around you without your input or your direction, then yeah, it could be actually harmful / deadly to you. So I think it's one of those things where you want to participate in the construction and the structure of your life.
Exactly. Well, like when you talk about that way, it's just like the imagery that's coming up is like, well, if you don't be intentional with it, you're letting a fun house be built, and it's like the scariest fun house that you'll ever go through, and you might not get out of it. Like the dude from Saw is going to be in there waiting for you for some way, right? Like that's that is like the crazy amount.
And the fascinating thing, the brain chemistry shows that when you're depressed, it's certain parts of your brain are activated, and when you're in kind of like problem-solving mode, it's completely different. Parts of your brain are activated. So there's brain chemistry science behind it that shows that it's useful and beneficial to be in action and in control of your own kind of life and your world versus kind of I call it the downward spiral, the poor me, and then and just because, and it's again, I'm not blaming anyone, I'm not pointing fingers at anyone, I'm not saying it's people's own fault, but I do think you should accept some responsibility for taking action.
Yeah. Well, I think it comes down to choice, right? Like, and if you want to, you may feel like you're super helpless in that moment, but you're truly not. Like it's like false chains. You look down and be like, oh, I've got these chains on, and somebody walks by and Jeff goes, hey, these were never locked on, right? They were just draped over you. You put them on yourself while you were sleeping, right? It's just like you do have the ability to start making choices, and they don't have to be big. It's just like it's that Sentinel moment that's happened because it was the last straw that broke the camel's back, and that was just a lot of little things that you made concessions on that added up to finally go enough, and your whole body just goes, that's it. Something's happening.
And that's one of the things that, like, again, to me, this is a very simple thing to do, but it's a mental thing. I'm like, there are a lot of kind of constraints that physicians put on themselves, like the patient comes first, I come last. And so, like, one of the things that I talk a lot about with clients and other people about is that you have to first give yourself permission to actually take care of yourself, to put yourself first, because if your bucket is empty, then you're not going to be able to help anyone anyway. So you have to give yourself permission to, mine was work out every day. That's like non-negotiable for me. And then once you give yourself permission, then the time appears, because people are like, oh, I don't have time, I can't do that. I'm like, you don't have time, or you're not willing to make the time, or you're not willing to give yourself permission to make that happen. So, it's one of those things where I think it's a mental shift where if you first kind of give yourself the permission, then all of a sudden the time appears, then all of a sudden the activity appears, and then that can actually start to help you get better.
Well, it puts you in like that solution mindset where you're looking at it, right? You say those different parts of your brain shut off. Is like your brain is keeping you in the spiral because at some point that was like a safety mechanism that kept us safe from being eaten by saber-toothed tigers. Right. And now our saber-toothed tigers are imaginary. They pop up on our phones and everything else. It's just like we can't escape them. And like we can actually take back that control and go, okay, what can I do if I want to be moving forward and like evolving? Be like, I need to actually take a really active role in this.
And that's one of the things like people are like doctors love to talk about. Oh, I'm so busy and whatever. And I was like, the first thing I tell them, I'm like, okay, I have one suggestion that will absolutely give you back like several hours per day. I'm like, put down your damn phone.
Yeah.
That's like number one. Number two, turn off all the notifications, turn off all that stuff. It's so distracting. All the brain science research shows that those type of interruptions take typically 20 to 30 minutes for people to get back to the task they were at. So it's like, turn off your phone, turn off all those notifications. And the Nielsen study, the last one I saw, it was from about 2 years ago. The average person spends 2 hours and 22 minutes per day on their smartphone, not like talking about patients, not texting to other doctors. This is just like, I'm like, Facebook or, LinkedIn or whatever, Instagram, Twitter, like we were talking about. So it's like, I'm like, that right there, that's like, you could read a book, you could go to the store and get great food, you could exercise, and you'd still have 30 minutes left. I mean, there's plenty of time, but I think sometimes is awareness and then permission and utilization of that time in a way that is beneficial to you.
Well, and I think there's a part of that is like when they look, like I'll use myself instead of pointing the finger elsewhere. It's like I've been in those traps where I've been like, I don't have time. Be like, actually, I just need to put this little device right here. What would happen if I was on it an hour less? What would I do with an hour? And it's just like,
I can tell you in a year,
I could run a show.
In a year, you can learn 2 languages, an hour a day for a year. You can learn 2 languages. You can read War and Peace like 3 times. It's 800 page. You could learn how to fly a plane like 20 times. You can learn how to play an instrument like 10 times. Yeah. So, I mean, it's like when you start to think about the amount of time that is available, it's the same amount of time for everyone, obviously. Yeah. But when you think about the amount of time that's available to you, it's just a question of what are your priorities?
And when I hear you talk about that, I almost want to start changing about time availability to time utilization is right. Like, it's like we all are gifted with 24 hours. You choose how to utilize it. And then like a bit of it that comes back to that accountability. Be like, how did you choose to utilize it? And if you were going, hey, I'm too busy, I don't have time to take care of myself. It's like, well, maybe the real challenge is the next one of like taking that look in the mirror and going, oh yeah, I'm not really, I should probably do something about that.
And then also and then eliminate those time sinks, eliminate the distractions, eliminate those things that do not allow you to pursue the things that you may say are priorities in your life. But again, for me, it's always about the permission, because then you mentally are like saying yes to yourself, essentially. And then once that permission is there, then all of a sudden the time and all those other things kind of reconstruct, like kind of are self-constructing around that.
Yeah. Do you have any steps to help people kind of take that, like edge into giving themselves that permission? Is there like a Jeff Moody like system for doing that?
Well, okay. So I think, it's, you can look at the Gestalt. I think the simplest thing is always take that first, like most blood boiling, thing that is making you the most burned out, is the worst thing that you, and it could, and you may be wrong. It may not be the most blood boiling thing. I thought it was my electronic medical record, which is definitely a part of it, but also finally, after probably about 6 months of some introspection and thinking and journaling and writing, is I have like an extremely high need to be valued. And so I was constantly, we had this productivity kind of app in our electronic medical records. So I was checking this thing like multiple times a day, like comparing myself against all of the other physicians. And so it was this like never ending race of, of me against myself and kind of against my partners, but, because I had to be number one, and so finally, instead of the step for me was that I finally realized was, instead of checking it like 10 times a day, is I got to check it once a month at the end of the month. Yeah. And then and like my life got much simpler, and I stopped chasing my tail, and it became much more clear that was not necessary and not a priority, but it was really driving a lot of my other behavior. It was driving me, adding patients on at the end of the day, working on days when I'm supposed to be off, taking extra call because of this paradigm or this thought that I had to be like number one. But I think I think it's a little bit like peeling the onion, as you might say, with your, peeled back. You need to peel things back, because you're like, well, okay, it wasn't that thing, but that helped. So now what's the next thing underneath,
Oh, and that's the whole thing. Like part of the name, well, it's an acronym for my kids, but it's as well, like I always think back to like Shrek, where he's just like, ogres are like onions. You got to peel back the layers to find out what's inside, right? Like it's not always what's on that top one. And as you start peeling it back, it's just like, oh, that felt good, and oh no, there's another layer.
Yeah, what's
right?
next? And the thing that I love about this process that we go through with clients is that it's like, yep, you got that one checked. So it's like, okay, what's next on the list? I kind of think of it's like the shampoo commercials or the on the bottles, like lather, rinse, repeat. It's like,
100%.
okay, so you did it once, good job. What's next? Because
Yeah.
again, it's to me. Burnout, like a lot of things in life, but I think definitely for this, burnout is definitely multifactorial. Many different things, many different factors feed into it. And that's why I like this box construct. It's like, man, the main reason I became a doctor is because everybody in my family is a doctor. Maybe that's a floor issue. Like, do you even want to be a doctor? Is that a thing? Even if you've spent the last 15 years of your life doing it, does it still make you happy? Do you like it? Like let's work on these different areas, these different surfaces of your box, so to speak. And the thing for me that I like, it just allows you to kind of codify. You can take each area and just start making lists. So like these are the things that are the blood boiling events for me in the mental aspect, in the physical aspect, in the spiritual, all those different areas. So then like unfortunately there's plenty to do usually for people. So that's what I like about it is you can kind of decide and prioritize what are the important things for you.
Well, yeah, like for me, like listening to that, talking about working on all those walls, it's just like anybody that's done a reno before, and you're like, oh, well, this won't be too bad. We'll just take this one wall down. You're like, oh, what have we started? Oh,
yes.
no, this is.
Now we need new wiring. We need new plumbing. We need whatever.
And it's always so messy in the middle of it, right? Like, I think that's the other part of that permission is like, oh, I'm going to start doing this work. It's going to be great. Be like, this is going to be the awkward part. Be like, it's going to be really, really horrible for a moment. Like it's got to,
True.
And that's part of it, right? It's just like when you finally put the light on it and you're like, oh, that's way worse than I was pretending it was.
Yeah, the making of the sausage, so to speak, not always the prettiest, thing. But I do also think that the thing I like about like picking one topic or one driver of your burnout and then devising a plan for that is then once you have success, so then instead of the downward spiral, you start to have kind of the upward spiral. And so then I like people. I think people like to see progress. I think people like to have wins. And so I'd like to have people have a lot of, actually, I have an online course as well. And I have a whole section about like, here's some wins. Here's some things you can do. Some like very easy 1, 2, 3 steps, like put down your damn phone. That's a win for me. That's a simple thing to do that could be a gigantic needle mover for people.
Oh, 100%. Well, and it gets people thinking and feeling about the wins as well, right? Like, and I think that starts to like that takes away for sure the hopelessness, but like that happiness can start to show up and be like, oh, well, this doesn't like, maybe I'm not like fixing my career, but like I'm like 1% happier than I was yesterday. Be like, does that mean I could be like another 1% tomorrow? And that stuff, it compounds.
Again, it's all additive, like for me, actually, I think the first thing that I was probably the biggest driver for me, other than helping kind of the office environment, some of the EMR things, the electronic medical record things for me, was sleep. I was a horrible insomniac. Like I was getting like 2 to 4 hours of sleep a night. And so every day was kind of like this just kind of angry haze fatigue thing every day. So I started to I did a lot of research into sleep. And so now I'm getting 5 hours sleep. Now I'm getting 6. And like, guess what? The next day is much more pleasant. When you get 6 or 7 hours of sleep, you're pleasant to the person at Starbucks and you're pleasant to your partners.
That's crazy talk.
Yeah, isn't? I know it is. So like the physical part for me was huge. Like I started eating better. I started using a few supplements. I have this like power shake thing that I have every morning. And I just like, I do feel almost like that there's like probably a small element of depression that was going on too about all this. And like the sleep and the diet, I think that fixed about 75-80% of this little depression thing. So then I was starting my day at a baseline of like, 7 or 8 instead of baseline of like 2. So then you're much more the slings and the arrows, so to speak, of the day that come at you every day. But it's like, wow, it's like totally tolerable when you have slept and, your nutrition is good and you exercise and you're feeling good. So it is it's a multifactorial, process.
And it's a journey too, right? Like you say, it's multifactorial, and these things stack up day over day, year over year, right? Like we didn't get ourselves in the situation overnight. Just like when I talk to people about physical fitness, be like, you didn't get there overnight. No. You're not going to get there, on the next day either. But you can start making those choices, and they will stack. And like over a course of a year, 2 years, 3 years, like you'll look back, go, wow, I don't recognize that person anymore.
Yeah. I had a patient come in, I saw him, and then like 6 months later I saw him, he lost 100 pounds in 6 months. I was like, what did you do? I'm like, I got to tell all my other patients who always tell me they can't lose weight. He's like, well, he got fed up. Finally, he was like, I can't do this anymore. And the first day he did 1 push-up, 1 sit-up, 1 leg lift. The second day he did 2 push-ups, 2 sit-ups, 2 leg lifts. Now he's doing 200 push-ups, 200 sit-ups, and 200 leg lifts every day. And, but I think also it's one of those things where like, once he was feeling better, he was eating better, and it's again, the upward spiral.
It is a web, right? They're all interconnected. And as you start moving it shakes it and moves it all up. You could have a success over here and it pulls up over here. And I like your analogy of starting the day at 80% is like, if you're going to actually, you talked about filling your bucket earlier, is like, I talk a lot about like, you've got to serve from your soft serve. So that means your bucket's overflowing and what's left is the juice for everybody else. Is like, if you can't fill up your bucket by the start of your day, be like, you're not giving the best to anybody. Be like, if you want to be number one, you got to be able to give your best, not like give from a really empty spot.
Right. There has to be something left for yourself and for the people you serve. I mean, whatever that is. Absolutely.
Yeah, man. So how is this rolling out now in your, the book's been out for a while. How are you still applying your learnings from this?
Oh, well, and I mean, to me, I always kind of say the book was probably 80% of the book was therapy for me, because I was just kind of working through the processes in my mind. And then finally I was like, you know what, like, if this is helpful to me, maybe somebody else might find utility in this. And so I'm like, well, I'll write the book. I'll see what happens, and it has been very enlightening for me. The people who approach me who have read the book, one of my buddies said he was on a plane, he saw the person in front of him on the plane was reading the book. I'm like, oh, I'm plane famous, but my thing always is I give in the book, and I think in general it's one of those things where I give many suggestions. I want people to I think everyone learns differently. I think people apply. They have different needs as far as what's driving their burnout. I think they apply maybe exercises or learning differently. So I'm like, I want to give people a bunch of things they can try. Like throw it on the wall and see what sticks. Number one. Number two, I do think that it's one of those things where I wrote the book. I was, I read a lot about burnout. I referenced a lot of things kind of at the time that were current. But, since then, we published it in the middle of the pandemic, and there's been a lot of post-pandemic research done on burnout. And, the information changes, the texture of burnout, I think, changes. And I think I'm still learning, I'm like, I every day I'm doing experiments on myself. Like, I'm going to try this supplement. How does this make me feel? Actually some things I had to cut out because I thought it was like, giving me palpitations, it's just, every day is kind of like I'm like my own, petri dish,
you're your own guinea pig.
Things out on my, I'm like, oh yeah, I probably can't do that exercise anymore, because it does something to my shoulder. So just, it's life, I'm like, I've been doing a lot with crypto because I kind of don't want my brain to turn into mush. It's like, it to me, it's a process. I want to keep learning about this. I want to keep learning about lots of different things. And I think that's important. And once you start to prioritize yourself first and get your burnout under control, then you can start to actually have a life. I do worry about people. They're so consumed about their burnout and the downward spiral that they kind of, it removes all the joy and all the enjoyment out of their life, and so that they probably need to talk to you, as well. But I think that that's important. And I think my family would definitely say from 5 years ago until now, there's been kind of a order of magnitude improvement in me, as far as, being around them and enjoying, everything about, being alive and family time.
You're just able to smile a little bit more. Like, one thing that stands out in our conversation is like you have this big beaming smile, Jeff. Was that something that was locked behind closed doors?
I think it was like my average face probably 5 years ago. And if I smiled, that was it. That's all you got. That's all the energy I had. I couldn't get one more millimeter of iota.
We're at a 1 already. Like this is it. Like,
that's it. I'm maxed out. That's all. I don't have any extra energy. I'm so burned out. I can't do anything else.
That's awesome, man. There's so many great gems were deployed in this conversation. It's just like it comes down to, like, for me, like what I hear is like when you're identifying that hopelessness, like, it's going to start to like have that tingle. You're going to get those body sensations. Like you know that it's coming and you might not feel it, but like hearing you talk about like journaling and still like pulling back the layers is like hit it before it gets too big, because you don't want that sentinel moment.
Well, and I think unfortunately, I think people need to, I don't want to say that, they get to the point where there's like a little something that like, that tips them off that something is not right. And so then that's when you start going on these journeys and on this learning. And if you're, and I hope that the kind of, for me, the book and all the other things that we do, I hope those are things that are useful. So you're like, hey, I was kind of in that situation. I kind of feel that way, like maybe I'm burned out, like maybe I should try some of this stuff, and again, I try to basically, it's kind of the hero's journey. You want to give somebody the roadmap, so like you can at least make it 75%, it won't take 5 years, maybe it'll only take 5 months, you want to help people short circuit those bad parts of their life and get better sooner.
No, I think that's awesome. Like providing the journey, and at the end of the day, be like, you can show them where to go drink. You can't force them to do it though, right? And sometimes people get really comfortable in that. Like they get almost I don't know the right word other than they just get comfortable in like this despair. They're like, well, I know it, and I can handle it, right? And what they're not realizing in that comfort is like it's got holes drilled in the bottom. They're just like slowly draining until it's like too late. But it's comfortable, so that like, why do I want to move? Like, I don't want to like get too like uncomfortable. Like this is already
and that'll require effort and work, and this is kind of the devil that I know, versus the devil that I don't know. But yeah, so I think sometimes that's why the Sentinel event is kind of helpful, because then it's like, ding, gives you that wake up that like something has to change. For some people, maybe it's a heart attack. I hope it's not medically. Some medical events, but I think some people it is. And, that's the thing that gets them to sit up and take note of what's happening in their life.
And it's unfortunate that it has to get that way. It'd be much better for everybody if we just got to a point and be like, oh, we got a broken keyboard in the office. Someone needs some attention, right? Versus, oh my Lord, we have a cardiac issue.
Yes. So at least I think maybe the exercise helped me stay out of out of that, at least for the moment. But yeah, I mean, there were times where like I would exercise once a week or less. So just I think the other point I would make to people is that this is a very personal response. However, maybe it's like taking a walk every day with your spouse or significant other. Maybe it's you interact with your kids more. Maybe it's you go to part-time work. Maybe you work less, and then you restructure your financial life to allow that to happen. I mean, the one thing that I think about, and I try to impress upon people, especially medicine, I think a lot of people in medicine think like there's one way to do that, to do things, and you got to see patients all day, and that's it. I'm like, well, no, you don't. Like, you can work part-time. You could go volunteer someplace. You could rearrange your finances to allow those things to happen. You could work for a pharmaceutical company. You could, go do clinical research. You could, write, speak, there are many, many options. And again, I think that harks back to kind of this like trapped in the box, kind of, helplessness, hopelessness kind of paradigm that people get into. We talk about in medicine that like, you're like, you have like the golden handcuffs, it's like, it's a very well compensated in general field, but like you're trapped, you're stuck. You have the golden handcuffs on, and some people talk about the golden treadmill. I kind of feel like it's the golden handcuffs attached to the golden treadmill. It's kind of is kind of where you are with medicine sometimes. Yeah. And for me, like another thing that I did is I stopped working 1 day a week. I'm like, I've been on call for 30 years. I have spent plenty of time in my life, outside of normal business hours. I'm like, then I'm going to take back some of my life during normal business hours, and did that. And actually, it's kind of interesting. I'm almost as productive, maybe a couple percent different, not working that 1 day a week.
Yeah. And what an incredible feat that is. And that happens a lot. Like when you like constrain it, be like, well, now all of a sudden, I'm not dicking around as much. Like I'm getting right to it. So there's an incredible like win when you take that whole day back, and you feel better for it, and you get to have that opportunity to do whatever you want. Yeah, and you want to go play pickleball, learn a language, play guitar.
And my wife's a physician too, and we both kind of at the same time started taking Fridays off, and we're like, every weekend is like it's a holiday. You're like a 3-day weekend every weekend. It's awesome. We're like, we should have done this like 15, 20 years ago. So that's been a real game changer, and very good for both of us and for our family and for everything, our health, etc.
Well, it means that you can have a recurring date nights every Friday.
That's right, Pickleball Friday.
Well, my friend, where's the best place for people to get in touch with you? Because I realize we're at the 42-minute mark, and I want to be respectful of your time.
We're just chatty Cathy's. So I am. You can use smoke signals. You could use a carrier pigeon. But if you want to go more high tech, you can go to my website, jeffmoody.com or jeffmoodymd.com. That's jeffmoody.com. You can, that's probably the easiest way. There's you can sign up for my email list. You can sign up for there are some live streams there. I do a weekly video tip, talking about burnout, weekly video tip. You could look into my course. It's called Burnout Recovery for You, and get the book. I had the good fortune of being included on the speaker panel for something called Champions of Wellness, which the Mayo Clinic puts out. That is on October 13th. You can go to championsofwellness.com and check that out. If you sign up for my email list, I'll give you a coupon for a 30% discount on the Champions of Wellness. So just, my point always is please get the help you need. If that's with us, great. If that's with somebody else, great. I'm like, raise your hand, get the help. I mean, You're too important, I guess. You're too important to not feel that you deserve to be helped and deserve to have the life that you need. The other thing I think about this is that, yes, we're going to help you with your burnout, but really what we're teaching you is how to live a better life, live a more fulfilling life for yourself. And burnout just happens to be the little Trojan horse in there.
To sneak all the good wisdom in there and all those good habits. Yeah. So just keep on renovating that house constantly.
Correct.
And picking, what I heard as well from you is like that balance is like picking one section at a time to work through, because you're not going to move at all if you focus on everything.
Yeah. Yep. Give yourself one success, and then you'll be like, okay, that worked. Now I'm going to work on the next thing.
I love it, man. That's some great gems to drop in this conversation today. I'm just so thankful for your time, Jeff. I really appreciate it. And before we go, I have the one question I ask all guests. All right,
Okay.
so we're going to hop into my time machine. We're going to dial it back to 10 years ago.
Okay.
And we're going to go back. We're going to open the door, and you get to give yourself one piece of advice.
The first one would be buy Bitcoin. Okay, buy lots of Bitcoin. But the second one would be don't be afraid to put yourself first and give yourself permission to care for yourself. That's probably the simplest thing I would say. I think that would have short-circuited a lot of pain and suffering.
Yeah, that's a great piece to end on, man. Put yourself first. Well, man, I appreciate it. That's some great insights, and I hope somebody's able to. We've been able to help somebody and have that little moment of reflection. So, everybody, Absolutely. Dr. Jeff Moody, a whole bunch of comments down below about how to connect with him. Make sure that you do. And as always, this is Gene, the Enjoyment Coach. We're signing off episode 58. And until next time, find one thing to give yourself permission to go do something good for yourself today.
Absolutely. Take care.